Hello, thank you for having me here today. My name is Susan. I have been working at Jefferson Center for 13 years, most recently as the coordinator of the adult outpatient peer specialist. I am a trauma survivor and have been challenged with bipolar disorder for the last 35 years. During my recovery, I have raised my son, established a new career, acquired a master's degree, and so much more. I've been thinking about the process of my journey and the access to services and resources during that journey. Here are a few of the challenges I and others face when trying to access services. For many individuals, a lack of financial resources prevents them from seeking help. For others, it can lead to inconsistent and inadequate treatment. I was fortunate that this barrier was not crucial for me. My family was very supportive and helped me to get the treatment I so desperately needed. Since my family was able to support me financially, I had insurance, which is a big deal. Even with the insurance and financial assistance, my services were costly. Co-pays and deductibles added up quickly as I required regular therapy, complicated medication management, and intensive treatment programs. The second barrier is a lack of mental health professionals. Clinics and providers often have long waiting lists, and individuals can suffer for months before they get their basic needs met. For those in rural areas, this is more difficult. To make matters worse, inadequate reimbursement from government and private insurance plans means fewer professionals are choosing mental health specialties in school, and some private clinicians are only accepting people who can pay out of pocket. Having consistent providers was key to my recovery. We also need mental health education and awareness. Physical injuries and illnesses are typically obvious, but mental illnesses are often hard to recognize. Serious conditions may not be obvious to the person suffering or those around them if they don't share their inner thoughts and feelings. Other times, people assume that their emotional or mental state is normal, not realizing that they are suffering from clinical symptoms. If a person doesn't know something is wrong, it's unlikely they'll seek treatment. It took me about 10 years to know something was wrong, get an accurate diagnosis, and make a commitment to my treatment. I am also a mental health first aid instructor and have seen personally how this program educates the community about mental health. The stigma associated with mental illness often prevents people from accessing treatment. In my case, I lost several jobs once my employer found out about my mental illness. I lost relationships with family members and friends. I also experienced self-stigma that interfered with access to the treatment process. Finally, there are significant disparities in mental health care among different racial and ethnic groups. Jeannie Miranda, a professor of psychiatry and biobehavioral sciences at UCLA, explains, quote, "Minorities are often more likely to be poor, less likely to be treated by doctors of their same race, and in many cases less likely to know that they have a condition that requires professional care." End quote. People are less likely to seek help if they think their doctor can't understand or empathize with their background and culture differences and experiences. I stand before you as a white Jewish woman. Although it's not obvious that I am different from others, I am significantly ethnically different. It was very difficult with my therapist to explain my thoughts and feelings about my Jewish values and activities. For example, my son's bar mitzvah was extremely stressful, and my symptoms increased significantly during that time period, and my therapist did not understand the significance of this life cycle event. Fortunately, my psychiatrist was Jewish and was able to step in and educate my therapist. I believe if we address access to care in a thoughtful and responsible way, the mental health system could be instrumental in helping individuals improve their lives so that they can reach their full potential. I want to thank you for your time and appreciate your listening to me.